Now we're going to go over the reconstitution of IV antibiotics. I have a helper here who's going to help me draw up while I do the calculations. So the first thing that we need to know is what we're actually giving and how much of it we're giving. So today we've been written up cefazolin of 50 milligrams per kilo. We know our baby weighs 3.5 kilos, so we need to work out our dose. The way we do that is we go 50 of the milligrams times by our weight, which will equal our dose. Our dose today is 175 milligrams of cefazolin. When we're looking at our dose calculation, we need to go online and look at our resource books to make sure that this is the correct dosage and it's the right amount for the right illness. The next thing we need to obtain is our actual vial of medication. In that, we need to know how much powder volume there is. So right now we have our cefazolin vial, and I've gone on to our online resource books, which I use the Paediatric Injectable Guidelines written by the Royal Children's Hospital. And that's going to tell me that my powder volume is 0.5. So this is important, and this is a new step for paediatric. So what that's saying is in this vial, there is already 0.5 of a mil worth of volume. So when we're doing our reconstitution, we need to take this into consideration. Our next step is to have a look online and see how much water for injection we need to add. What does our final constitution have to be? In the Paediatric Injectable Guidelines, it tells us that our reconstitution has to be at 100 milligrams per mil. We know that we have 1 gram in that vial, and therefore we need to make it out to 10 mils to get our 100 milligrams per mil. So we will have 1,000 milligrams in 10 mils, which also equals 100 milligrams per mil. But how much water for injection do we have to add to ensure that we get this dilution correct? Considering this is a neonatal dose, this has to be very particular. So what we're going to do is we're going to grab some water for injection and our 10 ml syringe. We already know that there's 0.5 of a mil of powder volume, so we need to add 9.5 mils of water for injection. A couple of things to note on the way is by doing the non-touch technique. So we're not touching any of the key sites that we'll be using. And we're also going to scrub the hub of our antibiotic. That seal is for tamper protection and not for infection protection. So at this stage, you check with your buddy nurse that you have exactly 9.5 in your 10 ml syringe. Awesome. And you can go ahead and add it to your cefazolin. This way, we know we have exactly 10 mils worth of volume in there, with a concentration of 100 milligrams per mil. You give it a nice good shake to make sure that we disperse the medication properly. As you can see, some of them take a little while and there'll be little specks floating about. The next job is to figure out how much of this we are going to need. We know our dose and we know our concentration, so we can go back to our what you want over what you've got formula. What we want is our dose, which we know is 175 milligrams, and what we've got is 1,000 milligrams, because we've got our 1 gram vial, and we've added a total of 10 mils of volume. This will give us how many mils we have to draw out from here, which will be 1.75 mils. which we then check with our buddy nurse. Whilst doing this, it's also important that we continue our 5 rights of medication throughout this. So making sure that we've got the right drug, we've checked our cefazolin, it's in date, we've got the right concentration. So ensuring that we follow these steps as we go. It's also important to notice the date on the water for injections and the saline that we use later as well. $1.75, great. The next step, which is also a pediatric specific step, is to dilute further. We need to reconstitute to a softer concentration to ensure that our tiny little peripheral lines are not at risk. So we want to stop any chance of it stinging and any chance of phlebitis. So what we're going to do is we go back to our pediatric injectable guideline book and we see the final step, which is our final reconstitution. In this book, it tells us that we need to dilute further to 20 milligrams per mil. And the way that we get this is we go back to our what we want over what we've got formula. We know that we want a dose of 175 milligrams. But what we now need is a reconstitution of 20 milligrams per mil. So that's what our calculation is going to look like. This calculation then equals 8.75 mils, and this is a total volume. What this is telling us is when we take this to the baby, we need to have 8.75 mils in total. So in order to know how much saline we have to reconstitute with, or compatible fluids, we need to take away the dose that we've already got. So we can do 8.75, take away the 1.75 mils of our dose. So we know we have to add 7 mils of water for injection. Oh, normal saline actually. So we're going to draw up 7 mils of normal saline. All right, and we check this final step with our buddy nurse as well. Beautiful. And then we mix our dose in with the normal saline that we've mixed. So today we're going to give this through a syringe driver. So we're also going to have to prime a line to connect it to our baby. So in total, we should have 8.75 in our 10 ml syringe. Did we get there? Fantastic. And now we can prime our syringe driver. When going to the baby, we then need to check that we've got the right patient, the right time, the right route, and no allergies with the family. Once that's done, we can give our smart site on the end of our cannula 15 seconds scrub the hub, let it dry, and we can connect it to our syringe. And this can now run as normal.